Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 15th, giving you the update from Albany Medical Center. All right, as per routine, we'll start with COVID. First graph, Capital Region, 8 counties. Fred, we currently see there are 39 people in hospitals in those 8 counties being treated for COVID. Those numbers match up with what we heard on our regional call on Wednesday.
Yes, Dennis, we heard actually on Wednesday there were 40 inpatients, 8 in ICUs and a couple ventilated. So that's up a little bit.
It's an almost doubling really from about 2 weeks ago.
Yeah.
So as we said before, we're going to really watch these numbers very carefully.
Not only are we paying attention, Dennis, but all of the hospitals in the region, because we get on that call, we share the information. Everybody has a sense of what's happening real time.
And you were mentioning the New York Times article the other day. They were talking about what's happening in Europe. We know Europe is having some challenges there, so we're going to watch these numbers carefully.
They published some graphs today. It's really remarkable. Europe is really shooting right up.
All right. Let's look at activity here at Albany Medical Center, admissions and discharges. And actually, Fred, I think we're going to try to fix this graph in the future so we can zoom in on it. But you can still see the last couple days we've had some admissions, so that's above the bar horizontally, those blue lines, and not a lot of discharges. And if you bring it in-house right now, we currently have 14 in the hospital.
Yes.
I think the number are 10 on the floor, 4 in the ICU, 1 in the ventilator. So again, a number that's higher than it was a week ago.
We clearly hit bottom in single digits, and now we're back up into the teens, which is akin to a couple of months ago.
All right, so we're going to keep a close eye on it. Shifting gears a little bit, but still on COVID. Fred, we obviously provide a lot of services here on this campus with COVID. We do testing here. It's not uncommon for health departments to reach out to us and say, can we assist in activities in the city, in the county? And when we're able to, we're happy to do that because we think that's part of our mission, and that request came.
It absolutely is part of our mission, Dennis. And so we were asked to staff a pop-up clinic in the Pine Hills neighborhood. Yes. I don't know the exact address. Today, tomorrow, and Saturday. And the idea is to offer closer to a population testing, and that population is college students.
Yes.
There are both college students from St. Rose and UAlbany that live in that neighborhood that, because of how teaching is happening right now, don't go on campus very much. So the state wanted to create an opportunity to do some testing there. So we're doing this along with St. Peter's. We're staffing today, St. Peter's is staffing tomorrow, and then we're staffing again on Saturday.
All right, great. And so some of our providers will be out there doing that testing, which will help the public health officials understand.
Helps us all.
I think Emily Wright from the faculty physician group as our nurse leader there helped organize that, and many others. So thank you to her, and thank you to those who are doing that work.
Yeah, it's really important.
All right, Fred, I'm wearing my Children's Hospital vest today because we both attended a press event today with the unveiling of our new ambulance for the Children's Hospital. So this is incredible. So this is the Bernard and Millie Duker Children's Hospital, and specifically it will bring people into the hospital servicing primarily the Masry Family Children Emergency Care Center.
That's right, Dennis. And you know, Dennis, we transport a lot of children, even tiny infants, into the hospital, but we also use this to transfer, on occasion, children who need to go elsewhere out of our community. We will use this about 500 times each year to move children into, or again, in some cases, out of the region.
Yeah, we heard the other one had transported, I think, 1,700 people over 4 years, but the technology requirements increased.
That's right. We're using much more sophisticated equipment. The technology, particularly for the preemies, has really accelerated. So we needed an ambulance with more oxygen, with greater ability to create electricity to run equipment, and frankly, a little bit bigger.
So this incredible ambulance is a partnership with Mohawk Ambulance and was made possible through incredible generosity by the Masry family, who have supported the medical center for many years. They support the health of the children in the region, and they're incredible partners, and so we thank the Masry family specifically for making that happen.
Thank you very much.
Fred, we talked earlier in the week about how we were going to speak about some opportunities for members of our workforce to get involved in some fundraising activities for various things. We'll talk about a different one next week, but today we're going to focus on Cycle Nation, which is put on by the American Heart Association, and it's a ride. Normally everyone gets together and do it. This year, obviously, different groups are going to break off, but Albany Medical Center has a couple teams. So before I list the teams, I know last year you rode in it and your wife rode in it, and it's a great event.
It's a great event. It was a lot of fun. I was tired afterwards.
Yes, for sure.
But a lot of people participated. You know, if you think back to that event, Dennis, pre-COVID, a lot of people in a small space really having a good time, huffing and puffing.
Right.
Not something we can do now, but
yeah, but we're going to
we've come up with a way to do it.
We have, and so I'm going to focus first of all on mentioning if you're interested in joining or participating or making a donation. We have many Albany Med teams. Team Albany Med, Sarah Ridinello is leading that team. We also have AMC Stroke Heroes, which I think Dr. Alan Boulos is leading, which is great.
That's great.
We have a team from Glens Falls Hospital, Code Stroke. And then, Fred, we have two teams that are led by stroke survivors. So we have Rosella's Riders and Team Orta. And I'm leading a team called Team 110%. So we're going to do it at Albany Med Fitness. We're going to do it in a safe way. We'll probably have teams come in and out so that we have the proper number in that area. But it's going to raise some money for a great cause.
It's very important. So please participate if you can. Donate if you can't participate.
For sure. When you were on vacation, Fred, I gave a little teaser and I said there are two good news stories coming. One of them was going to be that we were going to be opening up Dunkin' Donuts overnight, which has happened. And so I was able to deliver that good news. And the other was going to be some good news about entrances into the hospital. And so, Fred, I'll let you tell the audience what's going to happen with one of our entrances.
So on Monday at 5 a.m., we're going to open up to employees the 60 Garage Bridge.
Great. That's going to be the Pillars Bridge.
The Pillars Bridge from the 60 Garage. So it'll be swipe access to come through. It'll be open from 5 a.m. to 5 p.m. And this is really just for our employees. So it's going to be important for those of you that use that entrance. If someone wants to accompany you in, a visitor or a patient, etc., for you not to do that, not to let them come in with you, but direct them over to the B2 entrance.
And this is important, obviously, because the weather is changing, and so this is a direct way into the hospital. A lot of people made this happen. Obviously, our security folks will be manning it, because that's very important to us, they still be at every one of those entrances, IT, facilities, and I think this is going to be something that our workforce has been asking for, and we're glad to deliver it.
You know, Dennis, talking to Charles about this, this is kind of a hard entrance for them to provide security in. So shout out to them. They figured out how to do this and do it in a safe way for us.
Very good. And now, speaking of the Pillars entrance, for those who drove by it last night, you'll see that we've changed the coloring. And it's now lit up pink for Breast Cancer Awareness Month. So we're going to get a good photo of that and put it out on social media. But it's a good way. And maybe next week, Fred, we can even talk about some of the services that we provide for breast cancer here at Albany Medical Center. Lastly, topic is union. So as you know, we've been handing out these FAQs at the various entrances. And I think it's been a really good opportunity for us to provide to our members of our workforce, specifically nurses, the facts related to a union and a potential strike. Fred, a couple things have come up, so we thought we'd use this video to clarify them. So what are some of the things we've heard?
So first thing I would say, Dennis, this has been well received.
Yes.
The nurses have appreciated being given this information. One of the things that's come up has to do with whether this is factual. And I want to assure everyone watching this video that every bit of information on this sheet is absolutely true.
Yeah, for sure.
It is factual.
Right. Another one we heard, Fred, and I'll ask the question and you can answer it, is I've heard back from some nurses who said that they're concerned that if they don't join the union, that merit increases would not come to them because they think that somehow paying dues to the union is tied to whether or not they get a merit increase.
Dennis, that's not true at all. All of our employees will participate in the merit program, whether they pay dues to the union or not.
Right. So the other way to say it is there's really no value in paying the dues when the merit increase would come either way. Yeah, very good.
Absolutely.
And the last thing we heard some people say is that it's illegal for us to be sharing this information about how nurses could effectively resign from the union. I think you already addressed that. Our lawyers tell us for sure, and we know it to be true, it's very legal for us to share this information.
We're just sharing with the nurses what their rights are. It's absolutely appropriate and legal.
All right, good. Well, thank you for clarifying. That'll do it. So we're going into the weekend. We'll get our pop-up tent up. We'll care for people over the weekend. We always like to thank members of our workforce who are here working on the weekend, and I know many will be. And we'll be back again on Tuesday. Very good. All right. That'll do it. We'll see you on Tuesday. We ask that you once again please take care of yourself, take care of each other, and we'll see you on Tuesday.